Access to affordable and sustainable water, sanitation and hygiene is still a big challenge to many communities. This has negative impacts on the livelihood, well-being and health of many people across the world. According to a joint program by UNICEF and WHO, it has been established that more than 844 million people do not have access to basic drinking water. A further 2.3 billion people lack access to basic sanitation and hygiene services. In line with UN's SDG 6, which aims at ensuring availability of water and sanitation for all, HumanitarianGlobal.com has collaborated with world's best WASH experts to prepare an introductory course in WASH to empower more people in steering this goal. Undertaking a certificate in WASH program gives you an in-depth knowledge and understanding of Introduction to WASH. In the first module, the learner will get to understand the fundamental principles and approaches in WASH, global availability of fresh water, right to water and sanitation and the post-2015 WASH development agenda. Secondly, sanitation and hygiene. This module allows you to learn about sustainable sanitation, sanitation in schools, hygiene improvement and disease transmission routes. And thirdly, cross-cutting issues in WASH. In this last module, the learner will get to study some of the cross-cutting issues in WASH such as participation, gender, environment and inclusion of the most vulnerable community members. To register, please visit our website www.humanitarianglobal.com for more details.
Good morning everyone once again. Thank you for joining us. My name is Eric and I would like to welcome you to today's webinar session brought to you by Humanitarian Global. And to begin, I have two people I would like to introduce. The first one is Anthony. Anthony, as we wait for Anthony to join us, my second person will be Rose, who is our key speaker for the day. Rose, maybe before you begin, just to let's see if Anthony is there with us.
Good morning, Christopher. So thank you so much, Eric. I was trying to set up my computer. So thank you so much again to all of our participants for joining. My name is Anthony, with the Academic Registrar at Humanitarian Global. So I would like to take this opportunity to thank you all for setting aside time to come and join us for today's webinar. Before we do that, I would like just to brief you in a brief way what we do and who we are for those who might be joining us for the first time. And let me just try to project my screen in a quick way as we get started for the session in a few. So that's what I would like to do in a few. I'm trying to share the same. Okay, great. So this is what I've shared on the screen. This is the website for our institution. For those who might be joining us for the first time, so you can always go to humanitarianglobal.com. So that is www.humanitarianglobal.com. So that is our website, and basically there you can find all the information about who we are, what we do, the kind of training that we offer, and so on. So I would like, as we get started, just to brief you on who we are and what we do. And this is a piece of information that you may find on About Us. So we are an institution that is based in Nairobi, Kenya, with our main focus being to work with both humanitarian and development professionals. And we are happy to be having you today join this meeting. And what we really focus on, we make sure that we can offer training and learning opportunities to you. And how we manage to do so, we do have online courses, which we would even share with you the entire catalog within the email that we send to you, the one that contains the link to the Zoom session afterwards and also the presentation slides. So based on that catalog, you're going to see all the courses that we offer in the training programs. And in addition to that, we also ensure that we can organize for training in the workshops. In the comment section, I can see we even have directors of different institutions. You might be looking for a solution towards building capacity of your team. So we are the organization for you to reach out to, and we are the go-to organization. You can always reach out to us, and we can have a conversation even way outside the meeting just to follow up to understand the kind of challenges that you want to address within your team, and then we can come up with a bespoke training on the same. Additionally, we also organize for webinars like the one that we are going to have today. This is a free webinar. I would even encourage you to be able to share the link with your colleagues, and then they can be in a position to join. In addition to that, we also ensure that we can organize for virtual summits, capacity building, and team building events for your organization, or even maybe a group of individuals. In addition to that, we also support and promote community development. And one of the ways that we manage to do so is through training and learning. And this is where we ensure that we can always be able to participate and collaborate and partner with other institutions. So you might be having a very good initiative that you're doing. Always feel free to reach out to us. And then we can even see how best we can work together for the better good of the community, or maybe the society that we are in. Thirdly, through the pool of experts that we have, like today we have one of our experts in the field of water sanitation and hygiene. We do ensure that we can work with you in the capacity of focusing consultancy services. And that means you might be out there working on a wash project, or maybe a project in another field. You want to engage a professional in that area, an expert in that field. You can always come and engage us, and then we're going to further that conversation with you so that we can work with you in that capacity. Lastly, but not least of what we do, we ensure that we can champion and promote humanitarian and development work. How we manage to do so is if you go to our website where we are at the moment, there is a link for Humanitarian Global Community, the HG community. So this is a community of professionals, people who are in this field of humanitarian and also the development sector. And I would like to urge all of us who are in this meeting, we make sure that we can sign up for the community forum. So the community is a very good platform, and I would like even to open it and share the same with you to ensure that once you click on that link, you're going to be prompted to create an account. Very easy. And this is a free platform, so no charges, so don't get worried. It's a free platform for you. And this is where you get to interact with other professionals like you from different countries, different regions, because we have participants from different parts of the world. So I would encourage you, sign up for this platform. This is where we have conversations. This is where we have discussions. In case you have a question on a certain aspect, you can always come here and ask your question. So here we get to even further the conversation of this meeting for today, because it might be impossible to respond to all the inquiries, but we are going to set up you can be able to respond to the same here in terms of your question and the topic that we created, so that we can respond to you. I know the time is not on our side, but I'll be coming back with more updates as we go on with the presentation. So I would like you invite your friends, share the link on your WhatsApp status, on your WhatsApp groups, so that other participants may join as we get started with the topic for today, which is on household water treatment and safe storage. So with that said, I would like also to clarify, based on the comments that we can see on the comment section, this is a free event, so we do not offer certificate of attendance. However, we encourage you. We have further and detailed training on the same different courses, which I'll share in the next break that we're going to have, so that you may know the courses that you can enroll and study with us. So thank you so much. And I'd like now to invite back Eric. And before we do that, one last announcement. We already have your details, so no need for you to share the same on the comment section. Let's maintain the comment section for your feedback. For the inquiries, try to place them on the Q&A section, so that we can track them in an easier way as we respond to you. So thank you so much, and we look forward to a very productive time together with you. In case you want to inquire about our programs, feel free to drop us a message, and then our team is ready. So we have an entire team here. They're going to guide you on how to register and get started with your programs. So thank you so much, and all the best as you follow up with this session.
Thank you for that, Anthony. Thank you for giving us a good introduction to who Humanitarian Global is. And for the next person is our key speaker for the day. Rose, are you there with us?
Yes, Anthony. Morning.
Morning, it's Eric.
Oh, yeah, Eric, sorry.
Yeah, so maybe you can begin by giving a small introduction about Rose, and then we can move on with the session.
Thank you so much. Thank you so much, Anthony, and thanks so much, Eric. Thank you, Humanitarian Global, for the platform. And morning, everyone. So my name is Rose, and I'm a trainer at Humanitarian Global. I'm also an expert in the field of water and sanitation and hygiene, having worked in several contexts and having a couple of years of experience in humanitarian and also in development work. So happy to be your speaker for the day. Thank you so much. Back to you, Eric.
Rose?
Sure. Can I proceed?
Yes, you may proceed. And also you can share your screen.
Okay. Okay, thank you so much. Just give me a few. Let me share my screen. Okay, I hope all of you can see my screen.
Yes, we can.
Okay, and I hope I'm audible enough.
Yes, you are audible.
Okay, thank you so much, everyone, for joining us this morning from wherever you are logged in from and listening us from. So today, our focus will be on household water treatment and safe storage. And it is quite a broad topic, but I will endeavor to, just a minute. Okay, so it is quite a broad topic, but I'll endeavor to cover a few number of areas. And for our session today, I will be covering on practice and process. If you look at household water treatment and safe storage, it's really more of a process. Though sometimes we think of it in terms of technology, but it's more of a process, because if you look at it, you're looking at a process from maybe the source up to consumption. So it's more of a process really rather than technology, but we will focus in both. We look at it in both areas. So we'll cover on practice and process. So the process is actually from the source up to the storage area. And then also we'll focus on technologies. So in terms of technologies, we will I will be able to highlight a few of the technologies because we don't have a lot of time. So there are some technologies that I will highlight on and focus on more. We'll also look at why do we promote household water treatment and safe storage? So we will look at that also. We will also look at the advantages and disadvantages of the HWTS in general, though we will also look at the technologies, looking at the advantages and disadvantages. We will also look at the way implementation is done and some of the key considerations you need to put in place or need to think about in terms of implementations. As much as we promote household water treatment and safe storage, there are also limitations to this, and I will be able to highlight some of the limitations of the household water treatment and safe storage. If time allows, we'll also look briefly on how you can assess impact, maybe of your interventions that you're focusing on household water treatment and safe storage. So there are different ways that you can assess the impact maybe of your interventions. And lastly, we'll also be able to look at a case study. We'll only be able to look at a case study, and this one will not look in terms of implementation, but we look in terms of a technology. So this is the areas that we'll be able to cover today. So welcome to the session. Okay, so before we get into the technologies, into the processes, it's important for us to know why household water treatment and safe storage came into being and why it's still being considered as a good approach in terms of addressing water quality issues. So the World Health Organization estimates that improving both, this is water sanitation and hygiene in general, although our focus today is on water quality at the household level, but if you look at the WHO estimate is that if we are able to improve water, if we're able to improve sanitation, and if we're able to improve hygiene, we're likely to prevent at least 9% of the global burden of disease. So this is more on a general context, and also we're able to reduce about 6.3 of all the deaths. Among these diseases, the key one that's really related to water sanitation and hygiene is diarrhea. And so diarrhea specifically, it is thought that is very significant, and it in this burden of disease, the 9.1%, diarrhea is the one that is quite significant in relation to water sanitation and hygiene, which I know most of our programs really have been trying to address over a couple of years. And so what WHO also says that is that diarrhea represents a significant share of this burden. So the burden that we're talking about is the 9.1% here. So this results into an estimated 4 billion cases and 1.9 million deaths of each year. So the 1.9 million deaths are specifically targeting children under 5 years of age. And we know that most of the diarrheal cases are affecting children under 5 years of age, and that's why the focus really looks at that in terms of interventions. And specifically, if you look at developing countries, and I know where most of us are from, is that 19% of such deaths still happen in our countries, even at the moment. So diarrhea is a risk factor and also is a contributor to malnutrition. How it is that it contributes to decreased food intake. So if maybe, for example, children who are under 5 years of age are experiencing diarrhea, then they're not able to absorb food well. So you'd find that, so it's a contributor to malnutrition, and also it's a risk factor even in nutrition. So as a result of that, you find that they have low absorption of food, and also as a result of having diarrhea, you'll find that their resistance is low in terms of in terms of infection. So, and also diarrhea also contributes to that in the effect that it also contributes to impaired physical growth and cognitive development. And there's been quite a number of studies that have been done to show that there's a link between sanitation and nutrition. Though our focus is not on that today, but really a key focus when you're looking at diarrhea and children under 5 years of age and their nutrition. Okay, so the estimates from WHO and UNICEF, these are from the JMP standards of 2012. It was estimated that around 780 million people worldwide still lack access to improved water sources. I know there've been a bit of improvements from 2010, and I know still quite a number of people still have low access or limited access to improved water sources. So if you look at this population of 780 million people, it is said that about 3/4 of these populations reside in rural areas. Much of the populations in the world still, particularly in developing countries, really still reside in the rural area. So part of this, the large chunk of these 780 million people that we are talking about here still reside in rural areas. So in the rural area, you find that poverty is still severe. And also it's where the costs and challenges of delivering safe water is still greatest. I know most of us are working in the development world or are working in the humanitarian sector, and most of the programs that are most of the water programs are still focusing on the rural areas, because that's where the greatest need is still there. So the challenges and the cost of delivering safe water is still greatest in the rural areas. Although some water supplies may be improved. For example, I've given an example of protected water wells and communal standposts. So sometimes these systems sometimes fail to deliver safe drinking water. And the key reason is that they are usually maybe sited in areas maybe that are still prone to contamination, or you'd find that in terms of maybe hygiene and sanitation are still poor. So you'd find that even still in the rural areas, oftentimes we provide maybe protected wells, and maybe communities are accessing water, maybe from communal standpoints, you still find that there's still issues about the drinking water quality even at that settings. So you still find that much of the water in this from such sources, sometimes you find that they still have contamination from fecal sources. So this leads us to the point that the health benefits for safe drinking water is still elusive to many populations. So you still find that water also can still be microbiologically safe at the source, which I know most of us have worked in such projects where we provide water from improved sources. But if you look at the distribution points, they are usually subject to frequent and extensive fecal contamination, particularly during collection, during transport, and during storage in the home. And I've given an example that sometimes we provide maybe water through maybe a protected well, but maybe we have not incorporated maybe hygiene and sanitation, maybe hygiene promotion in terms of water handling. So you'd find that maybe at the point of distribution, or maybe mostly maybe at the time of collection, maybe the type of containers that maybe women and children, maybe they're using to collect water, maybe the way they transport the water, and sometimes maybe even how the water is stored in the home, you find that there's still issues about fecal contamination. So this tells us that there's still a long way for us to go in terms of the communities and the populations that we serve, in them having the benefits or enjoying the benefits of safe drinking water. So that's why here I have highlighted that health benefits of safe drinking water still remains elusive for a vast populations. And I'll be able to explain later in the slides that are coming up, what are the categories of people that our populations that we need to focus on in terms of household water treatment and safe storage. So now that we have realized that the need for safe water is still elusive for many populations, so that's where now the idea about household water treatment and safe storage comes in. This is an alternative. I've called it an alternative or an approach that will provide some kind of health benefits of safe drinking water while progress is being made in improving infrastructure. The key point here is that we're not saying that household water treatment and safe storage should be the focus like in all water, like in maybe providing safe water. Much of the progress should be really in terms of improving access to safe water, maybe use from different infrastructure and different water systems. But this, before we get there, we need to ensure that the populations we are serving still also enjoy the benefit of safe drinking water, while we are looking at maybe being able to provide with them with improved water sources. So the need for household water treatment and safe storage comes in that it's an alternative that even the WHO is talking about and promoting, in that it can provide safe drinking water for populations, it can provide safe drinking water for communities and households, even as we look at improving their water sources and also maybe improving water infrastructure. So, so now we look at household water treatment and safe storage. As we have said, that this is an alternative that we can explore even as we are thinking about improving our water infrastructure. So effective treatment at the household level. So the way it works, it uses the same principles that a conventional water treatment applies. We all know about the conventional water systems that are used. They are actually large systems that are used maybe in municipals and maybe providing water for a large number of populations. This is very much common in urban areas. So the household water treatment and safe storage system, it uses the same approach and uses the same principles. So the same principles of filtration, disinfection, and sedimentation. So it really borrows heavily on the conventional water system. So the household water at the household level, if we use the same approaches at the household level, it's able to remove and kill maybe or inactivate the microbial pathogens. So the focus for household water treatment and safe storage is on point of use. That's why I've highlighted it here. It focuses mostly on the point of use rather than the point of delivery. I believe this is clear. So for example, this is different. So a point of delivery is more at the source, but this one, the household water treatment and safe storage, it focuses on the point of use. This is at the household level. So, so treating water at the household level, it minimizes the risk of recontamination that even sometimes improved water supplies can present. So the focus on household water treatment and safe storage is on the point of use. So before we define what is household water treatment and safe storage, it's important for us to know and understand what is safe drinking water. So this definition, I got it from WHO. So the World Health Organization defines safe drinking water is that it is water that does not represent any significant risk to the health of our lifetime of consumption, including different sensitivities that may occur between life stages. So the World Health Organization defines safe water drinking water in terms of in that it does not represent any significant risk to the health of an individual. So it looks at different, what it talks about here is that at different levels, maybe at different, maybe for children, maybe under 5 years, maybe for pregnant women. So it looks at a whole course of life. So let's go now deep a bit in terms of household water treatment and safe storage. So it is recognized that the best way to reduce the risk associated with drinking water is by using what we call a multi-barrier approach. The multi-barrier approach is what I've put here. So multi-barrier approach is where we look at the whole process. So the multi-barrier approach, it doesn't look at maybe just one system, like maybe filtration, but it looks at the whole approach as a whole. And as I talked before, and I like that it is a process, it's what really the WHO is recommending. And also in that we should look at it from a whole process, not just look maybe at the source only, or maybe we only look at maybe disinfection of water sources, but it is a process. So this is what we call a multi-barrier approach. So if you look at each of the steps here, source protection, sedimentation, filtration, disinfection, and safe storage. So each of these steps in this approach, from source protection through water treatment to safe storage, it provides what I call an incremental protection against unsafe drinking water. So incremental protection means after you sediment the water, you can filter. After filtration, it removes maybe some of the maybe for example, maybe it's some of the sediments, but also you need to disinfect that water before you safely store and maybe before consumption. So this multi-barrier approach, it uses the principle of what we call incremental protection. So it provides protection at every step. So it's important when you're looking at household water treatment and safe storage, we look at it in terms of a process, and that each of the steps here is able to provide protection against unsafe drinking water and safe drinking water. So if you look at both conventional community and household systems, they follow the same basic water treatment process as I had highlighted before. So the whole process of sedimentation, filtration, and disinfection. So even the normal conventional systems, they use the same multi-barrier approach. So, but in terms of household water treatment and safe storage, so it uses what we call the low cost. So these are low cost options for each of the key water treatment steps to be followed. So it uses the same principles as the conventional system, but these ones are more low cost, what we will focus on today in terms of household water treatment and safe storage. So how we can define now household water treatment is that it is treating water and safely storing it in the home. This is what we call household water treatment and safe storage. Or basically, you've heard, and I think this is a common term that is being used, the point of use. So it is treating water at the point of use. So the 4 main stages is what I've talked about here, and we'll be able to discuss further even as we go on. Now, why the promotion of household water treatment and safe storage? So one of the key reasons is because it reduces or prevents diarrhea. Okay, so so household water treatment and safe storage can contribute to global efforts to provide universal access to safe drinking water. The focus is on safe drinking water. So we should also bear in mind that we are not focusing here on quantity or access to quantity of water, but we are focusing on the safety of drinking water. So in many settings, I know most of us are working in different settings. You can be working in an urban setting, or you're working in maybe a rural setup, but in many settings, maybe both rural and urban populations, they have sufficient access to maybe quantities of water, but that water may be unsafe as a result of microbial contamination. So the microbial contamination is what brings about diarrhea. So there's evidence that demonstrates that household water treatment substantially reduces pathogen load in drinking water, which can in turn result in a significant drop in diarrhea morbidity rates. Okay, and increasing an amount of evidence has shown that household water treatment and safe storage can significantly reduce diarrheal diseases. So diarrhea, as I had highlighted at the introduction, is a leading cause of death and illness. It kills around estimated maybe 1.9 billion children globally. So nearly 90% of diarrheal cases are linked to unsafe drinking water, poor sanitation and hygiene. So what I'm going to explain here, this is an example of studies. And these are a review. It was a systematic review by a number of authors that they did a review of published studies that suggest that improvements in water quality may make substantial contributions in preventing diarrhea. So there are many other studies that have been done, but I'm just going to highlight one. This is a result of a systematic review. So they looked at so many studies and they were focusing on a number of issues or a number of key indicators. So the indicators that these studies were looking at is in terms of hand washing with soap in relation to reduction in morbidity from diarrheal diseases. So these studies looked at hand washing with soap, it looked at household water treatment, it looked at sanitation, it looked at water supply, and also it looked at source water treatment. So this is a number of studies that have been done for quite a number of years. And also it's from different setups and also from different contexts. So from this, our focus is here on household water treatment. So studies have shown that if we improve household water treatment, we are likely to reduce diarrheal diseases by 39%. So why household water treatment systems is important is that because it prevents or reduces diarrhea, particularly among children under 5 years of age. Another reason why household water treatment systems is important is because it's cost effective. If you compare household water treatment options, the low cost options and the conventional water systems, you find that it is cost effective. So the technologies that are applied in household water treatment and safe storage, they are inexpensive technologies. So when properly used, or maybe communities are able to adopt and use them continually, they've been found that they are effective at removing pathogens from water. And this study is not really a study, but this was a review that was done in 2007. So this study, it looked at cost effectiveness of all leading household water treatment options. So the options that they looked at is in terms of solar disinfection, chlorination, ceramic filters, combined flocculation and disinfection. So it compared the cost of all leading household water treatment options for which data on health impact had been collected. So it was based also on the health impact. So the information that was used to derive this data, it was based on programs that had been implemented, and it was used to estimate the annual cost of household water treatment options per person per year. So this one, they looked in terms of, they compared this to the conventional water systems. So it is an indication that it is a cost-effective method that can be applied, particularly in areas, as we have said before, that are not benefiting from the conventional water systems. So it is also cost-effective. So that's one of the reasons that the need for household water treatment and safe storage. The last reason is that it's something that people can do for themselves. So as we said before, conventional water systems are usually expensive and they need a lot of technologies, quite a vast of technologies in terms of implementation. But why we promote household water treatment systems is that it's something that people can do for themselves. So for example, if we are talking about solar disinfection, that's something that you can train a community or households and they're able to pick it up and they can do it for themselves. For example, if we are promoting boiling of water, that's something that people can do for themselves if they understand the benefits of it. So another reason why we promote household water treatment systems is that it's something that people can do for themselves. So even in areas where people are not accessing improved water supplies, they can still be able to access safe water if they're able to adopt some of the technologies that we are talking about today. So as communities, as I said before, as communities are a way to access improved resources, those they should also be given an option to protect their health and the health of their children through household water treatment and safe storage. I think those are the three main reasons why we promote household water treatment and safe storage. I think I forgot something also about in terms of cost effectiveness. So I only highlighted something about cost effectiveness, but also you can look at it in terms of cost benefit. There have been studies, maybe if you have time, you can look at it later. There have been studies that looked at what we call cost benefit analysis. So you can look at the benefits of household treatment safe storage with the benefits. So for example, I can give you an example. If you're promoting household water treatment safe and safe storage, maybe in a school or focusing in school, you may find that you will find there be an increase in maybe school attendance and maybe reduction in absenteeism. So you can look at it in terms of cost benefits also. So that's as one of the reasons why you're promoting household water treatment and safe storage. Okay, so as I said before, that there are vast number of populations still lack access, and there are key populations that should be our targets. And I know most of us are working in some of the populations that I'm highlighting here today that really should be the focus for household water treatment and safe storage. The other populations still also benefit or we may encourage. I know also people maybe living in urban setups who also filter their water, even though people have access water from conventional water systems. Most of the time people have, let me say, doubts in terms of quality. So you'd find even at the household level, people still, even in an urban setup, people still use the household water treatment as an approach to make sure that they are consuming safe drinking water. However, the targets really it should be on these populations. So the vulnerable populations, I put them in 4 categories. Maybe there are more, but these are usually the target ones. So the focus should be on if you're working in areas with children under 5 years, the elderly, and maybe people who have compromised immune systems, like people living with HIV and AIDS. It's important that we target them in terms of household water treatment systems. Another population also is people who have maybe have been affected maybe by natural disasters, maybe like flooding, or people have been displaced by war, or people who have been affected by conflicts. Let's say generally people living or populations that are living in humanitarian setups. For those of us who have worked in humanitarian setups, you find like maybe usually the first thing that that comes to our mind in terms of safe water, we usually promote household water treatment systems before we look into the more improved systems for communities. So household water treatment systems also is a focus for people who are living in humanitarian setups. There are also populations that are affected by outbreaks of waterborne diseases such as cholera. I know most of the time for those who have maybe participated in a cholera response, so usually the WASH departments are usually the focus to make sure that the population that has been affected by cholera, they usually maybe do household visits to ensure that people are accessing safe water. So you'd find that most of the time people are given maybe aqua tabs to ensure that the water is safe. So another population that is a target for household water treatment systems are people who are affected by outbreaks of waterborne diseases. Another category also where we can target household water treatment systems is high exposure to contaminated water. So you'd find that even in the development sector, for example, we are working in communities that maybe they are in a remote location and maybe they don't have access to reliable safe water systems, or maybe they don't have access to improved water systems, maybe they don't have access maybe to a borehole, for example. So those such communities would say that they have high exposure to contaminated water. So maybe families or communities or households who rely maybe on surface water, or maybe on unprotected springs, or those who are living maybe in very high remote areas, those are also a target that for household water treatment systems. Also, you'd find in urban areas, you still find, for example, communities or households that live in urban slums. Some of them have no access to save water, maybe from the conventional systems, from the conventional systems. So you still also have to target them in terms of household water treatment systems. So these are some of the populations that we need to target. However, there may be others, but these are the ones that I've highlighted that are usually key in terms of targeting. Okay, now that we've talked about household water treatment systems, these are general advantages and disadvantages. So these are from a general perspective for all the technologies, for example. So here we're not talking about a specific one, but we're looking generally in terms of what are the advantages and disadvantages of household water treatment systems. As much as we've said that it's a good system, it also has advantages and it has disadvantages. So it is one of the advantages, which is key and we talked about before, is that it is inexpensive. As we said, that it is low cost. So you find that it is inexpensive and also it's cost effective. It's independent from an institutional setup or centralized systems. As we said, it is focusing at the household levels. It's focusing at individuals or households. So it does not depend on an institution, like maybe a water supply agency, maybe with, like what the central systems work. And another advantage is that it can be deployed faster than community systems. So you can deploy them faster. For example, I talked about if you're working in a humanitarian setup and you're looking at ensuring that a community is able to provide safe water to a community in a humanitarian setup. So that one means you can deploy fast to a community. It also improves microbial water quality and reduces contamination of risk between treatment and use. So much focus, by the way, is on household water treatment systems. It mainly looks at microbial quality of water. So it also has an array of technologies that you can employ. So it has a wide range of simple low-cost technologies. So some of these technologies is what we are going to look into as we proceed, and that they are available so people can choose the technology that's appropriate to them. We'll talk about this more when we're looking at implementation and also on the choice of technologies, that as much as there are a range of technologies, people also should be given an option to choose the type of technology that would be appropriate for them. So some of the disadvantages of household water treatment systems is that it's difficult to monitor. Why I say it's difficult to monitor is that a centralized system, you're able to monitor the system, but this one, because it's at a household level, you're not able to monitor if the households are doing, maybe are treating the water correctly. Maybe you can train a community or a household maybe how to use a filter, but sometimes it may be a bit difficult to monitor every household to ensure that they are able maybe to implement maybe a certain technology very well. So it's usually difficult to monitor technologies at the household level. This household water treatment system also requires high self-responsibility. So this one, because the focus is on the households, so it depends on, it is upon the household really to be responsible for their own water safety. So each household should be provided with knowledge on O&M on the system. So even as we deploy technologies, these simple low-cost technologies, there's need to make sure that and ensure that households are provided with the knowledge. So it needs a lot of awareness, it needs a lot of training, and depending on the approach that you will take, it's much about creating awareness and ensuring that each households are able to operate a system that they provide. We'll talk more about this when we look at implementation, some of the things that you need to consider when you're looking at implementing a household water treatment and safe storage system. Treated water may be lower quality than that is offered by well-designed systems. Here, what I mean is that, as I said before, you are not able to monitor all households. For example, if your community, if you're maybe raising awareness in a community or a household on how to maybe use purifiers, so usually has amount of time that you give after maybe you use a purifier before consumption, or maybe how the households are implementing maybe a certain system that you have given them. So it may be some households can really be able to take up and able to use the technologies quite well, and are able to have a good quality water. But it's said that it may be of lower quality than what is really provided by the well-designed centralized systems. So now that we have talked about that, we want to look at a few of the technologies. We may not be able to look at all of them, but we'll highlight a few of them today. So to select the most appropriate household water treatment options, what is needed for most of the implementers, what we need to know about the water quality as well as how different options really work. So before even you implement in a community or before you decide which method you want to maybe you want to deploy into a community, it's important also to ensure that you know about the different options and also look at their effectiveness. The focus for today, we'll look at a few of them, so we don't have time to look at each of them. So I'll highlight some of them. So, okay, so the first one, if you remember on my first slide, I talked about source protection. And I think maybe that's something that we miss out so much for those of us who are working in the development world. We forget to focus on the source protection, and we focus so much on sedimentation. We talk about filtration and we talk about disinfection. But source protection really, as we talked about the multi-barrier approach, it looks from the source. So we look first at the source protection. So before addressing methods of treating water at the household level, it's important to emphasize the need to use our best possible sources of water. So there are many ways in which pollution can threaten drinking water at the source or even the point of collection. So before even we talk about the other methods, it's important to focus also on the source. So sometimes you'd find the sources that the communities are using, for example, they are prone to contamination. So you'd find most of them are they have poor protection, for example, so they are prone to contamination. So protecting the water sources reduces or eliminates risks to pollution and can lead to improved water quality and health. So at the community level, some of the activities or some of the things that you can take up in terms of ensuring that the sources are protected is on regular cleaning the area around the water source, and also siting of latrines. I know this is something that we've talked about, and I know most of us are working also in rural areas when we are maybe working with communities in terms of issues of sanitation. In terms of also, sometimes we provide maybe improved water sources, but you find that when we line, maybe for example, the wells, it also prevents surface water from contaminating the groundwater. So these are some of the things that you can ensure in terms of protection of water sources. Okay, so the next step for us, our focus is on what we call sedimentation. So it is a physical treatment process, and it's used to reduce what we call turbidity. And there are many options that you can use in ensuring that water sediments. I've tried to give an illustration here, but there are two options I will highlight today. There are many other options, so I'll highlight two options. So the first option, which I think it's been promoted over the years, is what we call pot settling. So pot settling is like what I've demonstrated here, that you let water settle for a while and then you pour it into another pot and you let it settle again. So it's what we call pot settling. So the advantage of pot settling is that it's low cost and it's simple and families can really do it on their own. The key disadvantage of this one is that it is time intensive. So you can imagine having to settle water and you need that water maybe to treat it later and maybe to use it in a household. So it takes a lot of time. It only removes mostly turbidity. It reduces what you call turbidity. So in terms of it, you need to require multiple containers, as you have seen in this diagram here. So this is the first option in terms of sedimentation, and mostly it reduces what you call turbidity. So there's another option for turbidity, for sedimentation, apologies. So the other option is where we use what we call coagulation and flocculation. I know most of us who have worked in development world and who have worked maybe in humanitarian setups, I know I've been using this technology, for example, or this method, I call it a method, where we use purifiers. And the most common is this one, the purifiers here. is what has been used, particularly if you're working in communities who access water maybe from a service, maybe on service water. So sedimentation can be accelerated also using special chemicals, or also there are also plants that you can use also as coagulants. So what coagulants does, it helps, it forms lumps which settles at the bottom of the container. So there are a number of chemical coagulants. So the common one, which I know most of us know, is about this one, the purifiers. We call the purifiers or pure. This one has both, it's also a coagulant and also it has chlorine. So it does the two steps. So it does not only sedimentation, but it also disinfects. So this one has a combination of a coagulant and also a disinfectant. There's also another one which is called alum. I know most of us know about alum block. This is an example, this one. So it's also a coagulant. So it also helps water to form lumps, and also so that it can settle down and you're able to get clear water. We have also liquid alum, which also has been used in many setups. And also we have aluminum or iron salts, for example, ferric sulfate. So these are just examples of chemical coagulants that can assist in terms of sedimentation. There are places, and I know maybe some of you have even new ideas. There are also plants that have been known also to be coagulants. We have moringa seeds and also cacti. So these ones are also examples of coagulants that also can be used also to settle water very well in terms of sedimentation process. So what are the advantages of these ones is that they're also low cost, they're also simple and easy. And also the plant ones are also traditional and can be found in some regions. So the key thing about this coagulation is that it removes turbidity and also some pathogens. Okay, so but the main disadvantage is it's also time intensive. I know for us who have worked in areas where we are promoting maybe the use of purifiers, households need to have time, because it really usually needs maybe around 1 hour to produce maybe about 10 liters of water. Yeah, so for 30 minutes, I think it's around 30 minutes to get 10 liters of water. So it also needs a lot of time. The other one is about filtration. It's also a physical process, just like sedimentation. It's a physical process. It also reduces turbidity, and also it removes some pathogens. There are many types of filters that households use around the world. We have what we call biosand filters. We have what we call ceramic pot filters. We have membrane filters. But for us today, we'll focus on one. I want us to just focus on biosand filters. I think which has been used in many countries. I know many people have used biosand filters, and that will be our focus this morning. So this is basically how a biosand filter looks like. It is one of the things about a biosand filter is that it is usually, it takes time to develop it. And this is how it looks like. So it has many layers. And so it has a top layer here where you call a diffuser. It usually has what you call a diffuser. So this one protects the top of the sun. And where the biolayer forms, this is where the biolayer is being formed when water is poured into the filter. We will look at the operations, how it operates, but this is just how it looks like. So it has what we call the diffuser here, and then we call what was a biolayer, this here. So it's that's why it's called a bio. Bio, it's biological. Bio. That's why it has a biolayer. So a biolayer, it's a community of microorganisms that live in the top, this around 1 or 2 centimeters of the sun. So this is where now it eats the pathogens, or it kills, or it traps the pathogens when you pour water into it. It also has sand, this one here, the blue. You'll be able to look at it later when we share the slides. You'll be able to look at the colors. So the blue arrow here, this is now the sand. It is filled with sand here. So this is where there's filtration also happens here. This is where now the filtration happens here. So it removes pathogens and some of the suspended solids in water. So it's also the large part of the filter. It is here now where the sand is. It also has gravel here. So it also has gravel. So it also supports the filtration sand and also prevents it going to the drain of gravel. So, and then the last part of the biosand filter is the drainage. So it has a drainage gravel here. So here it supports the separation of gravel and prevents it going to the outlet tube. So this is basically how it looks like, and it takes time to construct. But when it's constructed well, it's able to provide good quality water for a household. It also, so here after the water passes through here, now we have an outlet here. So we have an outlet through here. So the outlet here is what after water it has flown all through, it has passed through all through here. It passes through here. It's by really, it passes, it's up here, and then now we'll have an outlet tube here. So the water now, you collect the water through this tube. So after the water now has flown through the sand and the gravel, you collect it through the tube here. So it works through gravity. Yeah, so it works through gravity, and you're able now to get safe water from this tube here. So your safe storage now, you now get your water through this tube into a container and should be able to access the safe water from this tap. This is basically how a biosand filter looks like. And so let me just explain basically how it operates in terms of how it traps the organisms and how it kills most of the bacteria. So this is how it works. I've tried, I got this from CAWST. So this is trying to explain how it works in terms of how pathogens are destroyed in the biosand filter. So here, you remember what I talked about, that we have a bio layer. So predation here, so contaminated water, you pour it into the top. Apologies. You pour the water to the top here, and you pour it once a day here. So we have a lid, so you open the lid and pour water here. So when water is poured to the top of the filter, it drips through the holes of the diffuser and flows down through the sand and the gravel. So here, the first part here, we talked about the bio layer. This is where the microorganisms in the bio layer, it is now some of the pathogens. So in the sand, you remember here, we talked about that we have a sand layer here. It traps some of the pathogens. They get trapped here in the sand. And also in the sand layer, is also what happens is what we call adsorption. Some of the pathogens get stuck in the sand grains and they're not able to go through down to the gravel. So also what happens here on the sand layer, also what we call natural death. So some of the pathogens that we talked about that have been trapped here. So because they do not have enough food or they do not have enough oxygen, now they die. So now we'll have now clean water through here. So this is what I was talking about, that there is the last layer after the gravel layer here. This is where now the clean water moves up here, and you're able to get your clean water from the tap, the tube here. So this is basically how biosand filter works. And I know many communities have been provided with this, and there's been so many testimonies about how the biosand filter has been adopted in many areas. Okay, so the goodness with the biosand filter is that you don't need any power. So it really works through gravity. And it takes about an hour to get about 15 liters of water. So 15 liters of water should be enough, at least for a family. As we said, you only pour water once in a day. So let's look at some of the advantages and disadvantages of the biosand filter. So the advantages is that it's affordable. So there is no ongoing cost. It can also be made from locally available materials. As you have seen, it's more on the sand and also on the gravel. So most of the materials that are required in making a biosand filter is usually locally available. It's durable. There have been evidence of high user acceptability. Most communities accept it. And then it can, it's also simple and easy to use. So if a community or households are trained on how to use it, it's also simple and easy to use. And you can also be able to get enough water treated for a household. The main advantages of the filtration or the filters is that they're usually heavy, should not move after installation. This is one of the key disadvantages of the biosand filters. So sometimes you find if you're working in a community and you find that the community is community that is mobile or communities that move, So it is usually a disadvantage that as much as you want them maybe to adopt a biosand filter, it usually, when after it has been constructed or after it has been installed, it's not supposed to be moved from the place that has been installed. So you cannot move it from one place to another. So that's a key disadvantage. If you are using a biosand filter, so if you have water that has maybe gone through chlorination, you do not use it on a biosand filter because the chlorine will kill the biolayer. The biolayer I talked about, it's a layer that has microorganisms. So if you pour water that has been chlorinated, it will not now be able to function well. So it usually takes time because you need to develop the biolayer. So usually it has to be set up and then it's given time to develop the biolayer before you start now using it in the household. Filters must be used almost every day to maintain the biological layer. So it has to be kept moist so that it becomes active and also so that it becomes effective and also it works well. So as much as the biofilter is a very good option for filtration, it also has disadvantages. And we'll also talk later about where areas that biosand filters have been used very well and also that's been adopted in many setups. So before we break, we'll also look at briefly on disinfection. So the common methods, I know most of us knows about this, is on chlorine disinfection, on solar disinfection, and also on boiling. For our session today, we'll focus on chlorine disinfection and also on solar disinfection. So briefly, allow me just to go through these methods. Okay, so disinfection at household level, the common ones that have been done, that have been employed is on the liquid chlorination. And this is an example of a liquid chlorination. We know about water or water guard. Yeah, this is just an example. It's a water purification, disinfection solutions. So a key advantage of using chemical disinfection is that it provides what we call residual chlorine, which protects against recontamination. So just like the normal conventional water systems, after distribution, it usually has what we call residual chlorine. So residual chlorine is able to provide protection even after maybe you distribute water, even in the common, in the conventional system. It's also inexpensive, so the households can be able to afford to buy the water guard. Most of them have instructions that have been provided on how to use it in terms of the amount of water that can be used maybe to treat and the amounts to use. It's also available in different countries. I know most of you will give examples, can give you examples in their own country. So they are different in many countries. They're also quite easy to transport. They're relatively quick. They're also simple and easy to use. So the disadvantage is that it has been shown that there are some parasites that are very resistant to be deactivated. So like maybe Cryptosporidium and worm eggs, they also been found to be not to be able to deactivate such parasites. So it requires clear water to be most effective. So sometimes you'd find people would want to disinfect water that is quite turbid. So chlorination cannot be effective in turbid water. That's why we talked about it's a process. You have to look at it in terms of a whole process, the multi-barrier approach. So if you are able to maybe filter water or sediment the water, now you'll be able to disinfect it very well. But if you just decide, maybe I'll just promote disinfection, but you find people are disinfecting water that's still turbid, that has not maybe gone through maybe filtration, for example. So it becomes a bit ineffective. Another disadvantage, which is very key, is the taste, which is usually unacceptable to many of the users. I know for many people have tried to promote the use of water guarded, but you find communities and households like they don't like the taste. Even in the conventional water systems, you find like maybe water that's provided by the municipal councils, for example, you would find some people do not like the taste because of the chlorine taste in the water. There's also need to wait for around 30 minutes before consumption of water that has been disinfected with chlorine. Another disadvantage is in terms of users are required to purchase the chlorine. It's more of a consumable that needs to be provided like on an ongoing basis. So maybe households sometimes may not be able to purchase the chlorine maybe at a particular time. So usually that's a disadvantage of chemical disinfection in that users are required to purchase chlorine on a continual basis. The last one on disinfection is about SODIS. And this is a method that has been promoted in many, many countries. But one of the disadvantages is that it's you only use, you need only maybe the PET bottles to use. So most of the PET bottles are usually available. It depends on renewable energy, depends on the sun. So, but you cannot treat so much like large quantities of water. So you can only maybe, as you can see, we use PET bottles. So you may only be able to disinfect maybe small quantities of water. And one thing about SODIS is that it does not change the taste of the water, unlike maybe the chemical one. So the water still remains the same. Okay, so it's also quite simple and also easy to use. So if communities or households are trained or are shown how to do to disinfect their water using solar, they are able to adopt it very well. Okay, so the disadvantage of this is that it really needs a lot of time, because you need about 7 hours of exposure when there's good sunlight to be able to ensure that the water has been disinfected. So there's no residual effects like the one for chlorine we talked about. There's a residual effect. You should the water is able to be saved even after you are done with, after you've removed from maybe the rack, from the rack. So, but another disadvantage also is that it also requires water that is less turbid. So you cannot be able to disinfect water that's still turbid. So it also needs clear water, same as what we talked about in terms of chemical disinfection. Another disadvantage is that it also requires enough solar radiation. So sometimes in areas that are quite cloudy, you may not be able to promote the use of solar disinfection. So another disadvantage is that you cannot produce a lot of water. So it's not useful in treating large volumes of water. So it is more maybe for household levels, so that maybe you look at maybe producing maybe about 4 liters per day or 3 liters of water for drinking water only. So you're not able to produce large volumes of water if you compare it with other, like maybe solar chlorine disinfection. Just lastly, before we continue, in any of the methods that we are talking about, for it to be effective and also to make change and to bring change in the health of the communities, it is what we need to aim for: correct, consistent, and continued use. Oftentimes you find like we promote or we work in areas, but communities sometimes adopt and then they're not consistent. And sometimes you may visit, or when you're doing monitoring, you find some communities or households are no longer maybe utilizing maybe an approach that we have promoted. So that one may not be able to give us the benefits that we are looking for. So even as we promote household water treatment and safe storage in communities, there's need for us to ensure that there's correct, consistent, and continued use. Because if our households or the populations that we work with are able to use the methods properly, we are able now to be able to experience the health benefits. So our goals really cannot be, we may not be able to achieve our goals if the communities that we are working with are not able to use maybe the methods or approaches that we're promoting correctly, consistently, and continually. So if we use them on a continual basis, we now need to, for us to ensure that they use it in a continual basis, we now need to incorporate what we call maybe, for example, maybe hygiene promotion, for example, or we need to bring in an aspect of behavior change. So, and you know, behavior change really takes time. So we need to also look to ensure that the communities that we are working with, are they correctly using the multi-barrier approach, for example? Are they using it consistently, and is it continually? For that, now we'll be able now to get the full benefits of household water treatment and safe storage. So the last part is on safe storage. So in terms of safe storage, it's important that even if we have treated the water, now we are at the level of after disinfection, it means the water also needs to be safely stored. So most of the time you find, even though the water has been treated well, you find that poor safe storage can bring in the issue of recontamination. So using safe storage containers, it reduces also the issue of recontamination of of drinking water. So it's all about keeping treated water safe from contamination. So there are many ways that you ensure that the safe water is stored well. So these are just an image of water that has been stored well and an image of water that has not been stored well. So even after we have treated water, there's likelihood of recontamination, particularly at the household level. So you'd find sometimes water has been treated, but it's stored in a container that has a large, that has maybe, for example, that's left open. So there's likelihood of recontamination. So some of the factors for our containers that that are promoted or are required in terms of safe storage is that they should have a strong and tightly sealing lid or cover, like for example, this one. It should also have a narrow opening. It should also be stable, and it should also be durable and easy to clean. So there are usually a number of things in terms of safe water storage. For example, in many households, you find water has been treated well, but they are kept in an open container like this. So an open container like this, you'd find maybe children or maybe household pets are able to access this water. So the water just becomes contaminated again. You'd find also maybe sometimes that they are not well covered. Yeah, so those are some of the aspects that bring in the issue of recontamination. So as much as we have treated our water, and also communities have treated water, we should also promote the use of safe containers in terms of storage. I know most of us who are working maybe in humanitarian setups or in development setups, we have also seen when we procure containers for water storage, most of the organizations I've seen and worked with, they usually promote the use of such container, this one, in that it is easy to clean, and it also has a tight lid, and it's also usually have a narrow opening. So in terms of even when you're procuring containers that maybe you want to deliver to communities, you also need to look at aspects of if that container is able to provide safe storage for the treated water that maybe you have promoted in a household. Okay, these are just some other safe handling water practices that needs to be adopted and promoted in communities. So using specific containers for collecting and storing water. So even in terms of, for those of us who have worked in the development sector and also in the humanitarian setup, so when you're even procuring containers for communities or households, you find most of the time you give around 2 or 3 containers per household. The reason being is that so households should have a specific container for storing treated water, and they should have another container for collecting water maybe from a source, or maybe they need also a different container for treating the water. But also specifically, we need to have a specific container for storing treated water. Another practice also in terms of cleaning, I think it's something that we miss out as development and humanitarian workers. Sometimes when you do monitoring and you go through maybe you do a bit of household visits, and you'd ask a household, for example, where do you store your drinking water? And sometimes the container that you're shown, you find like, wow, it's not clean. And so this is something that we miss out. So it's about as part of hygiene promotion or as part of your awareness raising, you also include aspects of ensuring that the containers used for safe for storing treated water should be clean. And also where the containers are placed, they should be placed off the ground and also away from mostly the pet animals in the household. And also in terms of how to access the water, is easier when water is poured out instead of scooping. So if you store water in such a container, it needs you to scoop. So when you scoop with maybe a cup, you are likely to recontaminate the water. And then also it's important to promote within communities using water as soon as possible that you have treated. So when you're doing, it depends on the technology that you're promoting. You know the amount of water that a family needs or a household needs. They should be able to treat that amount of water for that day and be able to use that for the same day. I think we should take a 5 minutes break, and then we can come and talk about limitations and then also implementation of household water systems. Thank you so much. Back to you, Eric.
Thank you, Rose, for guiding us through the first session. And I see our participants are keenly following on, and I'd like also to encourage them to send more questions to the Q&A. I can say we have a few, but as we wait for the questions, I'd like to invite back Anthony to guide us through something small.
According to United Nations, it has been established that 1 in 3 people do not have access to safe drinking water, 2 out of 5 people do not have a basic hand-washing facility with soap and water, and more than 673 million people still practice open defecation. These statistics are worrying, and the continued increase of unsafe hygiene practices are a health hazard to many people across the globe. Thus, effective and sustainable interventions are needed to reduce spread of such diseases, which will alleviate human suffering and ultimately save lives. When more people such as local emergency response workers develop a good understanding of water, sanitation and hygiene strategies, more lives will be saved. To help in these efforts, HumanitarianGlobal.com has worked with world's best WASH specialists to develop a comprehensive online diploma program in WASH that will help participants to acquire enhanced knowledge and expertise in water quality issues. In this module, you will get introduced to water quality issues and learn more about water safety plans, water treatment and water quality surveillance and testing. Secondly, sanitation. In the second module, get to learn about sanitation in schools and emergencies, sustainable sanitation and how sanitation links to health, nutrition, agriculture and food security. Thirdly, hygiene and disease transmission. In the third module, you will learn more about hygiene improvement, disease transmission routes and the F-diagram and hygiene perspectives at both household and community levels. And fourthly, hygiene types. In the last module, you will get to learn more about hygiene types such as personal, environmental, domestic and food hygiene types. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
So thank you so much, Eric, and to all of our participants. We've been following up with your feedback on the comment section, and we can see that you're really enjoying the session, and most of us, they are even asking now, because for these free webinar, there is no certificate of attendance, or what can I do when it comes to further training on the same area and other areas, and also maybe to get a certification for the same. So as we take a break, I would like just to mention, as based on the theme for today, where we are focusing on the household water treatment and safe water storage. You can see we do have a program, a diploma level program on water sanitation and hygiene. And this course does take a period of 6 months. And here we have 4 modules that we do cover. So within a period of 6 months, each module takes a period of 1 month. So this is now the paid program. It's highly subsidized for you, so that you can also get to enroll for the same, for further training and getting awarded a diploma for the same. So we encourage you and for you to be able to join. And you can even see here, based on the topics, the first module, we talk about water quality issues, and you can see the 4 areas that we tackle there. So based on even what we are doing today, it's more of maybe just one of the topics in a very shallow way. So you can imagine now taking a course that has the full training on the same. It's a very detailed session for you that you can be able to follow up with us as you enroll for this program. That is the first module on water quality issues. The second module, you can see we talk about water sanitation and hygiene. And this is where we look at sanitation in different contexts. We know most of us, based on the kind of WASH programs you're doing, you might be targeting schools, you might be handling sustainable sanitation programs, emergency sanitation response, and so on. So there's a lot that we also cover when it comes to that particular module. The third module now, we talk about hygiene promotion and improvement. And this is where we even now try to go back and see the various ways on how pathogens move from one point to another, where we look at the disease transmission routes. And here, most of us, they might have interacted with the F diagram, and that's what we tackle there. We try to use that concept of the F diagram to take you through the various routes on how pathogens move from one point to another. We also focus on hygiene perspectives, looking at both the household level and also the community level. And that is our third module. And then the fourth module, we look at the different types of hygiene. So based on even the topic that Rose has been taking us through, we talk of more of hygiene, talk of personal hygiene, environmental hygiene, domestic hygiene, and also food hygiene. So as we look into the various ways of water, household water treatment, and safe water storage, we are focusing on how can we promote domestic hygiene and more importantly, food hygiene as well. So this is a detailed course, and currently we even have our offer for this particular course. If you can enroll for the class of September, which is starting on the 5th of September, so that is like a week from now, next week, Monday, but 1, you're going to get a 10% discount on this particular course. So we urge you to sign up for this course. The initial cost is 1,000 USD for a period of 6 months. But if you can register today for the current ongoing intake for the September class, you're going to pay $900 for the tuition fee. So that means you're going to save 10% on the same. So we encourage you, join us. Let's get to train you on this particular area. And for further inquiries on how you can join us, feel free to drop us a message on the chat section, and we are going to guide you. So thank you so much. And now I would like to invite back Rose so that we can proceed with the second segment for the presentation. So for any inquiries on how to sign up, feel free to reach out to us on the chat section, and we are going to guide you through so that you can enroll for this wonderful course and for you to enjoy the 10% discount. So thank you so much.
Thank you so much. So because of time, we're going to proceed. So allow me just reshare my screen again. Okay. So let's continue. So allow me just to highlight a few limitations of HWTS. The first limitation is that the main focus is on improving water quality. So it does not generally improve in terms of quantity. I think that should be clear, that the focus on household water treatment system and safe storage is on quality. So the focus, it does not focus so much on quantity issues or issues of access to water. But sometimes the only unique circumstance is that you may be working in an area where you're trying to ensure that people who are accessing water, maybe from surface water, surface water. So those are just a bit unique circumstances in terms of you're trying to ensure that even though people are accessing water from surface sources, they also get quality for the water. But basically, household water treatment systems focus on quality and not quantity. So as such, it should not be an alternative per se in terms of providing improved water sources. So as I talked about before, is that as much as we would love all populations, all communities to be able to access safe water, but it should be from improved sources. But before we get there, we focus on HWTS. So it's not really an alternative, but it is just an alternative in terms of safety, but a focus really for water access, even from, if you look in terms of what JMP standards talk about, is communities should be able to access water from an improved source. So this means that we should not divert, it's not about diverting resources. So resources should be focused on providing sustainable, safe drinking water to communities in accordance to the SDG target. But as I've said, that resources are very limited. There are not much resources maybe to reach all communities as at a go, but this is also incremental in terms of as we move in ensuring that all communities are having access to water. Some at this point may not be able to have access to safe water. That's why now we go to the alternative of providing quality water in terms of using HWTS. So it also provides, HWTS also provides or improves in terms of microbiological quality. However, most of the systems, as you've seen it, they're low cost really, and they're not able maybe to protect from some of the cysts because they're usually very difficult or they are usually resistant. So some of the cysts are even resistant to chlorine. That's one of the things that I highlighted before. And you find that some of the household filters sometimes are not effective. As I said before we took a break, in that for HWTS to be effective, it must be used correctly, consistently, and also exclusively among the populations that we've talked about. So these are some of the limitations of household water treatment systems. There may be other limitations, but these are just a few that I just decided to highlight for today. Let's look a bit, just briefly, on technologies. So as we've seen before, we have so many technologies. So which one will you choose for a community? So let's say many of us are working maybe in a development area, or you're working in a humanitarian setups. And humanitarian setups, you can be working maybe in an emergency, or maybe you are working in a stabilized community, for example. Which technology would you choose? So this you can use these criteria, but there may be other factors that you can consider. So some of the criteria that influences technology of choice. The first one, which is very key, is on effectiveness. What we talked about earlier on is that how well does the technology perform? So effectiveness, you are looking at the ability of the technology to provide sufficient water quality and the quantity. For example, that I gave in terms of maybe a biosand filter is able to provide about 60 liters of water. That is one of the things in terms of effectiveness. So when you're choosing a technology maybe to promote, or maybe you want to promote in a community, you have to look at effectiveness. How well does the technology perform? Also in terms of appropriateness. So appropriateness is in terms of how does that technology fit into the people's lives. For example, let's say, for example, I was giving an example of a biosand filter. Sometimes it is a very good technology, but if you're working in a community that is nomadic, a community that needs to move after maybe 6 months or needs to move after 3 months, it becomes not appropriate in such scenario, because as we said, it should not be moved from one place to another. So it becomes like it may not be appropriate for maybe such a community. So you have to think in terms of the technology, how it fits with people's daily lives. So some of the things or questions that you can ask yourself, for example, can the technology be manufactured in or near the community using local materials, for example? So the technologies that you choose, is it appropriate for the community or the people that you're working with? Because it should not disrupt people's lives. It's something that should be able to improve their lives. So you also look at in terms, for example, you can ask yourself, is it convenient for women and children to use the technology? If the focus, for example, in a community, and you find like in a household, it's usually maybe the women and children that are maybe in a household, and they're the ones who are concerned with water handling. Is the technology that you are introducing, for example, is it convenient for the women, or is it something that really takes a lot of their time? If you're introducing a technology, for example, that you need the women to be, you need like 1 hour or 2 hours of their time, they'd feel like it's really maybe wasting, let me just say it like, so it needs a lot of time, and they also need time for other activities. So you need to look at the technology that's appropriate for the community. You also need to ask yourself about how will the technology last? So if you have a technology that you want to promote, and it can last maybe for 2 months or 3 months, and then maybe it needs to be replaced, or it needs to be refixed, or it needs to be maintained, you would also look at people really willing to accept such a technology. So you need to ask yourself such questions before you introduce a technology. Another criteria that you can use in terms of choosing a technology is on acceptability. What will the people think of the technology? So one of the things that you can ask yourself is, how will the treated water look, taste, and smell? As we said before, sometimes people usually are very keen on how the water tastes. So you need also to look at the technology that you're introducing. Will people really accept the taste of the water? And in the long term, the technology, is it going to provide maybe convenience? Is there going to be health improvement? is there going to be maybe savings in terms of money with the community that you're working in? So another key criteria that you need to consider when you're thinking in terms of technology is in terms of acceptability. Another key criteria really is cost. So what are the costs to the household? So all these technologies that we talk about, there is a cost for that household. Most household treatment options, really, they're not free. As much as we've talked about, they're not free, there's a cost implications to it. So can households, for example, afford the full cost of the technology? So sometimes, even if we say about purifiers, for example, they are easy, they're available, but they usually need for maybe a continuous purchase or supply of consumable, because that's a consumable product, the purifier, for example. So households, are they able to provide? Are they able to purchase? Even if you're providing maybe on a subsidized basis, or maybe you're depending maybe for, maybe there's a partner that is maybe covering some of the costs. At the end of the day, is there any cost that the communities are required to provide? So you'll have to look in terms of the cost, because it means if the households or the communities are not able to provide after, maybe like if it's a project, for example, that is promoting maybe the purifiers, for example. So maybe after the phase out, who will be able to provide for the community, or the community will lapse back maybe to using and save water. So you have to look at the cost implications. Also, there's also a cost. I think this is one we forget so much. There's a cost in raising awareness in the community. So even if it's an NGO, for example, or agencies that are promoting a certain type of technology, or who are looking in terms of the whole, looking at the whole multi-barrier approach, we've talked about this cost, but the cost also in terms of who is going to raise awareness in the community. If you're going to work with maybe community volunteers, or you're going to work with us, maybe community agents, those also need, that's a cost in terms of training. So there are a number of things you need to think in terms of cost as you're thinking about a technology to promote. So another criteria, also another aspect is on implementation. So now that maybe you've decided on a technology, so in terms of implementation, before even you start implementing, there's a number of questions that you need to ask yourself. For example, what's required to get the technology into people's homes? So one of the things that you can ask yourself, for example, how is the technology manufactured and distributed to the household? So let's say, for example, you've decided to maybe promote household filters, the biofilter, for example. How is it going to be manufactured at the house, maybe within the community? And even if it's within the community, how is it going to be distributed to all households that you are targeting? So there is issues about transport and logistics. And also for, in terms of, we talked about operation and maintenance. So even if it's a rural community, is it, if there's, maybe if a technology needs a bit of repairs, is there a skill within the community to repair maybe the filter, for example? You need also to look in terms of if households sometimes have questions, or maybe they face a problem, who is going to address them? So it goes back to the issue of costing, for example. If you are going to work with maybe community agents, or you're going to work with community health volunteers, it means you need to make sure that they are well-versed, and they should be able to, they are also trained on how maybe a system works, and they should be able to provide support. That's like after service, they should be able to provide a support to the communities. You also need to think in terms of monitoring. So what monitoring is required for the technology? So there are many aspects about monitoring. So just a few examples of things that you need to ask yourself, even as you think about implementation. So those are some of the criteria that you can think about in terms of technology, which really influences the choice of technology you want to promote or you want to work with in a community. Also, in terms of implementation, so there's no standard model, but there are a few components that you need to have in mind in terms of implementation. The first one I talk, let me highlight just a few, about 5 components. There may be more, but the first thing is about creating demand. So creating demand is about raising awareness in a community. How will the community know about your technology? How will people know about a product? How will people know about the benefit of maybe a technology you want to promote. So the way for our community to know is about creating demand. So one of the key components that you need to have in mind in terms of implementation is about creating demand. So you need to ask yourself, for example, what would be the barriers to product purchase, for example? So let's say, for example, we've said as part of your implementation, you will need people maybe to purchase the liquid chlorine, for example, like the chlorine, liquid chlorine, for example. What would be the barriers in terms of purchase? Because that's a consumable that communities will need it over and over time. So it means you need to ensure that you have addressed the barriers to access. So the first thing is about creating demand. And I'll give an example here. There was a project that was called Clean Water for Haiti. So how they promoted or how they created demand in the communities. So they were promoting biosand filters. And so they placed them at strategic places. So they placed it, the biosand filters in schools, health centers, churches, and homes of community leaders. So why they did so, those were strategic places where they knew they would be able to have people see. So they used the points as points of demonstration. So when people were able to see for themselves that filtered water was better, there were improvements in people. They were able to adopt the filters because they saw the success of the demonstration. So one of the things in doing, in creating demand, you can set up demonstration sites so that people can be able to see what the product that you're talking about. So one of the key things is about creating demand. And one way you can do it is setting up demonstration sites, because you can have a very good technology like biosand filters, but people do not know about it. And people usually have questions. So if you put up a center where people are able to see, they should be able to ask questions and they should be able to see what you are promoting. And they should be able to make an informed decision in terms of adopting maybe your model. So that's one of the components in terms of implementation. Another component is about the product. So we talked about the product. So when you're looking at supplying products and services, so you need to look in terms of, if you're going to focus on consumable products, for example, like chlorine, so you also need to look at, for example, consumable products need to be constantly replenished, for example. So it means you need to look at the barriers that I talked about. How will communities be able to access these products over time? So one of the things in terms of implementation is looking at supplying the products and the services. So you can look at a comparison. This is just an example. So you can look at a comparison of maybe consumable products like chlorine and maybe a durable product like filters. So let's just look at these two examples. It gives you an idea in terms of when you're looking at the supply of products and services. So for example, if it's chlorine, that's a consumable product, it needs to be constantly replenished. It has no capital cost, but it has regular recurring costs. It means like maybe every month you need to supply, or every fortnight, or every week. So one of the things also about chlorine, it should be self-sustaining without subsidies. That's what I was talking about. Sometimes, apologies. Sometimes you need to look at your products. Do you need maybe a partner? You need to partner with other organizations, or you need to subsidize. So you also need to look in terms of sustaining it. Implementation, if you're looking at consumable products, you can work with, you need to think in terms of distribution and also in terms of marketing, so that people are able to know where to get the product. If you look at it in terms of, and let's say your product will be maybe a filter. So in terms of a durable product like a filter, you'll find that it's a one time. You only install it once. So you don't need to, it doesn't need something like every time. But it's very expensive. And sometimes the cost may be subsidized. If you're working with, if it's an agency trying to subsidize for communities. And this one usually implement this in terms, it's usually similar to community programs, really, how you implement a filter, biosand filters, for example. So in when you're implementing HWTS, one key component that you need to look at is in terms of products and services. Another key thing, which I talked about earlier, is on monitoring. So after you've rolled out your project, for example, or a program that's focusing on HWTS, how will you monitor for improvement? So what will you measure over time to ensure that your initiative is successful? Or how will you adapt and improve your initiative based on the information you collect? So most of the time we implement a project or you implement a HWTS, but you've not decided what are you going to monitor. So WHO have come up with, they have a toolkit, which I will not have time today to focus on, but I've put a link there. You can go and study what some of the indicators that they suggest in terms of monitoring household water treatment and safe storage. So you can have a look at this link later to understand more on how to develop your own indicators. You can adapt it to your project on how to measure and also evaluate the success of your project. And also it gives quite a number of indicators that you can look at. Another key component is about engaging others. So when you're implementing a HWTS, it's about working collaboratively. So you may find yourself that you're working with government, you're working with community leaders, you're also working with other stakeholders. So the key to success in implementing any HWTS is about engaging with others and also forming partnerships. Another key component in implementation is also on financing. I think this is something that has come up even before, is in terms of how will you fund all the components of your initiative, and also looking in terms of what are the costs to the households that you serve. So financing looks at it in terms of two key areas, in terms of maybe as a partner, but also much more on the household, because at the end of the day, it is really the household that is our target. And you should have a sustainable program. So another key component in terms of implementation is on financing. The last part is on what we call building capacity. How will you build the capacity of the stakeholders? We've talked about here, we need to engage others. So we need maybe, for example, to work with community health teams or community peers, for example, but they need capacity. You need to consider capacity. So you need to build capacity for household. Sometimes you may need to build capacity if you're going to manufacture maybe your biosand filters, for example, from a central place. So also you need to build their capacity. You may need also distributors. You may need also educators, or you may also need service suppliers to perform their roles well. So a key component in terms of implementation is also focusing on building capacity. Okay. So in terms of how will you assess if you're, how are you going to assess the impact of household water treatment systems? So there are three main approaches that have been documented that you can use to assess the impact of HWTS. So one of the approaches that you use is you use what you call previous studies as evidence. So this means that if you look into the literature, if you look into reviewed studies or peer-reviewed studies, you will find there's a lot of literature that has already documented the impact of different options in many different contexts, and you can use that to assess impact. So this means that you don't need to reinvent the wheel, and you don't need maybe to design a study if you want to assess the impact of your intervention. So if you look in the literature, there's so much that has been done and has been documented on the impact of different options, like the example I gave before on cost effectiveness, for example. So there's been a large number of studies that have been done to show cost effectiveness of some of the options. So you don't need to maybe to do a new study. But in case there's no study that has been done to demonstrate the impact maybe of your intervention, you may need to do an assessment. This is the second approach, where we do what we call direct impact assessment, focusing on health improvements. This approach is usually very expensive, and it's usually more of epidemiological studies, really. So usually a rigorous assessments, and they are very, very, very costly. They usually take time, and they are very costly. So if you consider that the evaluations that have been done before, there's no strong evidence, so maybe that's when now you can decide to do a new assessment, impact assessment. So I'm not saying that you don't need to do impact assessments, but I'm saying that it's usually very, very expensive and also takes a lot of time. But it is also one way of assessing the impact of household water treatment and safe storage systems. The third one, I said there are three main approaches. Another way also of assessing the impact is what we call indirect. So instead of assessing the direct impact, we use what we call an indirect approach. You can follow what you call an indirect approach. So this one, you're investigating the impact using easier to measure intermediate outcomes. So you look at it in terms of outcomes. And these outcomes are the ones which really directly contribute to improvements in health. So there are three ways that you can look at it, the outcomes. So you can look in terms of coverage. So if you are ensuring that maybe looks at ensuring that HWTS is targeting the appropriate population. We talked before about targeting or the populations that you target. So if you are targeting a certain population, so you look in terms of coverage. Another way is another intermediate outcome is in terms of performance, ensuring that the method is used is safe and microbiologically effective. So if, for example, the methods that you are using, for example, if their communities are using them very well, that's another way of looking at performance. And also in terms of adoption. So what we talked before about if the communities that we are promoting HWTS are able to correctly use and also consistently use and exclusively use the options that are given. So if there's high adoption rates, is also one way ensuring that it's a way of telling you that you have a positive impact, for example. So in terms of adoption rates, performance rates, and also in terms of coverage. So these ones are indirect measures. So they're not direct. So direct ones is where you do a study here. But indirect ways, there are ways that you can assess an impact of an intervention using indirect methods. So these are examples. You can look at it in terms of coverage. You can also look at it in terms of performance, and also you can look in terms of adoption. Okay, so lastly, allow me just give an example. I say that I'll give a case study. It's this is an example from South Sudan. So Oxfam has been working in South Sudan, and I just decided to pick one of the examples of a filter that they're promoting. I think they were promoting it a while back. I'm not sure if they're still promoting it. But just for our study today, for this session, so there's a filter they call Lifesaver Cube. So this is how it looks like. So it's a container. It's just like a container, but it has a different elements which I'll explain. So the key features of this are, so it is you pour water. So let's just look at the components, how it looks like first. So it has a filling cup and a pump. So this is a cup that's opened, you pour water, but it's also a pump. So this cube is filled through, you fill water. It is this cup here. It is filled through this cup, and also it has a pump. So this is where you build the pressure in the cube. This is the cube really, but it's a container. And then now this, and then it has an outlet. So it's an all-in-one. It's an all-in-one container. So it has an outlet. So after you've poured the water through here, you have to pump it. I'll show you in the next slide how it operates. And then so now after you've pumped the water, so this is where now you get the filtered water from here. So it has a membrane. This is now where we have filtration happening. So it has a membrane here. So it's just a plastic container. It's a tough plastic container. So the container is designed to resist internal pressure, built and when in use. So it's also very robust. So the key features of this household filter, it's used in households. So it has potential to remove viruses. So unlike some of the methods that we talked about before, it has a nanomembrane here. So this membrane is able to remove most even viruses. Because as we talked before, many of the systems really on household water systems are looking at microbial quality. But this one that was designed by Oxfam, it also has potential to remove some of the viruses. Okay, it also reduces the risk of recontamination because the water, after you've put the water here, the water, when you open the water from this outlet tap, it's water that's ready for drinking or for maybe cooking. Yeah, so there's no risk of contaminating the water again. So the system also, the way it works, there's no backwashing. I know most of the water filters, even we've seen in household, it needs you to backwash to make it sure it's clean, but this one doesn't need backwashing. It also has longevity in that it can last a family for more than 1 year. So let's look at how it really works. Okay, so this one I got it from Oxfam, yeah? So you can look it up later. So this is the first step here. So as you can see here, so you fill the cube with highest quality of water available. So it depends on where you're getting the water, but you look at the water that you are getting. So this, you fill the water through the first cup. You remember this part is what we talked about here. So, and then you pump. So after you put the water here, you pump from here. So pump the handle approximately 10 times until the pressure has developed inside the cube. So this is how you pump. So the pumping is just from here, still what happens here. So it is, you open here, fill the water, cap it, and then you pump the water. So this is where you do the pumping. And then now you twist the cap here now. This is where now you get the water out from here. So the water, the cubes, the way it looks like, you can use it upright on its side, or you can hold it like a jug. So this is how it works. So the way it works, this is a filter that can be used mostly in households, and it's also portable. So it's usually the advantage is that it's portable. You can have so many and you can distribute them very easily to many communities. Maybe if you're working in communities, you have to cross the lake. Maybe you have to, cross so many places and you need to carry thousands and thousands of them. So the container it's a plastic, so it's able to be transported to a long distance. So this is just an example of a household filter that was developed in South Sudan and by Oxfam. So you can read about it later much to understand how it works. And I know for maybe our participants here, most of you and maybe are from South Sudan, you may have come across this cube. So thank you so much. So if you want to learn more, as Anthony has talked about, you can enroll into our programs, and you can enroll either in a certificate course, a diploma course, and also in a postgraduate course. So thank you so much for the time, and back to you, Eric.
Thank you, Rose, for guiding us through the second half. And I think we can just go straight into the Q&A. We have a few questions from our participants before we give them a chance to ask questions live.
Thank you so much, Eric. So let me open the Q&A and try to address some of the questions. Okay, thank you so much. I'll answer a question from Maya. It's talking about what kind of soap recommended using during cleaning water storage containers. I think the soap that is used for cleaning water containers is just a normal, because today we're talking about households. So soap that's used for maybe cleaning household dishes is the same one that you can use for cleaning water storage containers. You're also asking what storage containers are easily cleaned by soap. So most of the storage containers that I've seen and that are being promoted are usually just the plastic. There are other types of storage containers that people can adopt or use. Sometimes there are maybe those which are made of clay, but what I've seen mostly is on plastic containers, because they are easily cleaned, and also they are also easy to carry and also easy to store. So there's no prescribed container really, but most of the storage containers are that are used, I've seen most of them are plastic. You're also asking, are there organizations with simple techniques of well drilling? I'm not sure about this, but in terms of drilling of wells, so that's on improved water sources, for example. So there are many, I don't know which country you are from, but I know many organizations or many companies really provide drilling services, but I'm not sure what you're asking about simple techniques. But in terms of well drilling, there are companies that do really well drilling. Okay, most of you asking about the biolayer. So biolayer, it is, you get it, so you pour water. So if we go back, just allow me just go back again. Let me just go back. So the way a bio layer is, I said it's a bio. Bio means it's a group of microorganisms. So you need to grow it. Maybe later you can leave your emails. I can share with you a link for you to understand more and read more, because this was just an intro. Just give me time. Okay, so so I talked about it has a bio layer. So it's a bio layer. It's bio. Bio. It's microorganisms really. So it takes time. So when you pour water, we said like when you pour like contaminated water. Let me say, for example, yeah. So let me explain. So the way you grow a bio layer. So I said before, like you need to grow it for a while. So a bio layer, it has a community of microorganisms. So microorganisms is what we know in terms of maybe a bacteria. Let me say, for example, so it has a bacteria. So you need time to have this layer to form, because when you just put up a biosand filter, the way you just construct, but you need to make sure that you have this layer of microorganisms here. So usually when you pour your water, so most of the water that we talked about is contaminated water. So that's contaminated water. When you pour the water through the lid here, so that layer is what really starts trapping or eats some of the pathogens in the water. So it makes now the treatment of water better. So as I said before, you need to have time to make sure that the bio layer is well formed to be able to provide that action really. So you may leave for us your email. I can send you a link where you really understand more how the bio layer really works, because if you're able to understand how bio layer works, that is really the key component here that really helps in terms of filtering water in a sand filter. So I will be able to provide, or in the community group, we may be able to provide with you some a detailed information really on how biofilter really works. Because I see most of you are asking how the biofilter works, particularly on how the bio layer really works. So we'll be able to provide for you when you go to the community group to see how the layer works. Okay, someone is asking about solar disinfection. Someone is asking, my question is on solar disinfection of water, and I'm not really clear, is that the water is exposed directly and heated by the sunlight? Yes, so the word SODIS, it is solar, solar disinfection. So you expose the water. I think this is the slide that I mean. So that you expose water. So you put water in a PET bottle. This is an example of a PET bottle. So you put water in a PET bottle and you expose it on sunlight. So you can have maybe on top of a roof, maybe a metallic roof, for example. So you expose water in a PET bottle for about 7 hours when there's a good sunshine. So when you expose water in sunshine, that is what really is called solar disinfection. I hope that is clear. So it comes from the word solar disinfection, SODIS. Someone is asking, one time in TV, I've seen machine that we add salt and put in for 10 minutes after the machine product. This one I'm not very sure. Okay, this one maybe you can expound more on this, because I'm not sure about the name of the machine.
Rose, maybe I can look it up and I can get back to him.
Yeah, sure, thank you.
Okay.
Someone is asking, if you don't have tools to implement, how will you do it? Okay. Okay, so one way, okay, if you don't have tools to implement, how will you do it? So as we talked about before, household water treatment systems are usually very low cost. So for example, if you're working in an area and you find that maybe one of the ways that you can help communities is maybe by promoting SODIS, or solar water disinfection, that's something very easy, as we talked about. So you just need to have maybe plastic bottles, and you can be able to demonstrate to communities how solar water disinfection provides quality water. So there's some methods that are really easy to even implement, even without cost implications. But you can also partner. I talked about some of for these approaches in terms of household water treatment systems. It's about partnerships. You can partner with their organizations really that are also working towards promoting household water treatment systems. Someone is asking, I'm looking at, I'm interested in, okay, from South Sudan, there's flooding. Okay, this is more of a general question in terms of flooding. Yeah, so in terms of flooding, that's why I said, for example, so if you're working in an area that has flooding and you want to ensure that people have access to water, safe quality water in a short term, because in the long term, you need to look at providing more durable solutions. So I talked about people may be affected by floods. One way also of ensuring that they have access to clean or safe water in a short term is by promoting some of the technologies that we've talked about today, but particularly in terms of ensuring, because you find in a flooded area, most of the water systems, maybe they are broken, and you may find that maybe there's fecal contamination. So maybe you need to ensure that maybe people are provided maybe with purifiers, for example, or maybe to ensuring that also they have access maybe to liquid chlorine. So those are some of the things that you can take it up early enough as you look at more comprehensive and developing more stable systems for water supply in a flooded area. Okay, someone is asking, in areas where people have scarcity of water, how can we apply household water treatment? So I said that there are many areas that people have water scarce and people are accessing water maybe from pools of stagnant water, for example. Maybe that's the only source that communities can access. That's a place that we can say that they have scarcity of water, and maybe it may take time maybe to develop more sustainable systems for them. That's where now we can apply household water treatment systems. Because I say those are some of the populations that we focus on, that we have communities that we work with where they are faced with a huge water scarcity, and the only option that's available is maybe from surface water, maybe pools of water, maybe that is stagnant, for example. That could be the only option that's accessible to the community. That's why I say that these systems can be of great help to such communities. So people who are living in areas that have high scarcity water, you find such people also are also faced with the challenge of accessing safe water. So you can promote household water treatment systems in such communities. Also, someone is asking about plant coagulants. So it uses the same principles. We can discuss this more even in the community group. So it uses the same. Let me just go back there. So it uses the same principles as the same principles as the other coagulants. So it has been used in some contexts, in some areas. So it uses the same, it works the same way. So if you can use, I gave 2 examples, there may be other, which we can look at, you can also look up at others. So there are also others, but the 2 key ones are moringa seeds and cacti. So these ones, they've been used, those are traditional methods really. They're not the conventional, these are traditional methods that other communities have used. So where they get the seeds from a moringa tree, and then they just use the seeds, and then they can also place it in water. So it just helps the water coagulate. So it uses the same principle like the chemical coagulants. So someone is asking about what technology advice can you give to pastoralists to use for the best practices in their respective locations? This is what I talked about before. So sometimes we have very good technologies, but we find that we are working with nomadic people. So most of the times you find pastoralists are people who are nomadic, and people who do not maybe stay in one place for a long time. So in such a case, for example, you cannot promote the use of maybe biosand filters, because the biosand filters needs to be stable, and they're usually very heavy, even to move from one place to another. So you cannot promote that side technology. So as I talked about before, there are many considerations you need to put in place when you're thinking of a technology, for example. So in terms of the community, is it fitting with their way of life, for example? So maybe, for example, if you're working with pastoralists, for example. So the example I gave, for example, in South Sudan, the saver, the lifesaver cube, for example, that is an example that it's something, because it's just a container that even pastoralists can work with it. So it's something that they can even work with it, even for many, with them, even as they move with their livestock. So before you advise even a community, if you're working with pastoralists, you need to look at which really can work with them. So even if, for example, if you want even to promote, for example, maybe purifiers with a pastoralist, you know, for example, if you're promoting, for example, maybe a purifier like this, you need to look at, because for your purification to happen, they need to have at least 2 containers, because you need a container to mix, to do the mixing, and then you need to pour you need another container to pour the clean water into. So you need at least 2, maybe 10-liter containers for doing the process of purification, and then you need 1 storage container. So you also need to look at, if I promote a purification using of purifiers among pastoralists, are they able to be working with all these containers? So you need to look at options really that can really be workable with the communities that you're working in.
Hi, Rose.
Yes.
Rose?
Yes, thank you so much, Eric.
Maybe a final 2 questions so that we can move on to the part where they ask questions live due to time.
Oh, sure. Because of time, we can pick up the rest of the questions. Okay, someone asking about turbid water. It's difficult to treat in rural area because no time detention, or either you choose biosecure or chemicals at household level. Which do you think is more preferable? So cleaning turbid water, it's difficult. But if you remember when we talked about, we can promote. We can promote what we talked about, pot settling. That would work. This is just an example that sometimes we may not be able to access, maybe we may not be able to access chemical coagulants, for example, in a rural area. So one way is maybe to promote pot settling, because communities can be able to get the materials that are needed for pot settling, for sedimentation, for example, in a rural setup. This is just an example. So the rest of the questions, we will answer them on the group. And thank you so much, everyone, for your time. And you can join us in the further sessions that we have. Thank you so much. Back to you, Eric.
Thank you, Rose. I think for this time, we can allow our participants to ask questions. And for you to do that, you can simply raise your hand. And I will unmute your microphone and give you an opportunity to ask our facilitator, Rose, today. And I can see a few hands up currently. Amos Lebogang, are you there? Amos Lebogang, you may unmute your microphone. Amos, are you there with us? Okay, as we wait for Amos, I can see, okay, as we wait for also Mawich, I can see a Dr. Adeyemo.
Okay. Can I go on with my question?
Yes, you may go on with your question.
Okay, thank you very much for this thing. I was asking a question that I hope the plastic containers we use in water treatment don't have problem with toxic elements. Like they are telling us not to drink bottled waters made of plastic again. And I see some of the containers we were given, particularly that one from South Sudan, is plastic, and most of the ones we use are plastic. I hope plastics are safe. Thank you very much.
Rose, are you there with us?
Yeah, sure. Thank you so much. Thanks so much for raising the question on plastics. So there are types of plastics. Let me just go back to that. Just allow me just go back. Okay, so I get your point. So sometimes we talk about plastic, but there are different types. So there are materials that used to make plastic bottles, but the ones that I know we promote for, even for household water systems, even as agencies, really, we promote the ones that have been really shown to be safe, that can be used by communities, and they are safe. So like this one, for example, that I'm talking about, it is something, the type of container. So even if you go back and read about it so well later, you can find that it's not as simple. You know, we usually have different types of plastics, but this container, although it's plastic, but it is made from material that is acceptable also in health. So even as agencies, when we promote use of plastics, maybe for water storage, for water, there usually types of plastics really that we make sure that they are also in line with what maybe WHO is also recommending for use for households. Because I believe also agencies also add, our key goal really is to make sure that the safety of the communities that we work with. So I know the plastics that are promoted are usually the ones that are also that have been shown not to cause any harmful effects to humans. Thanks so much for raising that question.
Thank you for that, Rose. I hope that is clear, Dr. Demo.
Yes, I am. Thank you very much.
Thank you. I can see a few more hands. Minala Sancho, you may unmute your microphone. Minala.
Hello.
Hello, Minala.
Yes, please. Hello.
Yes, we can hear you.
Okay, thank you very much for giving me the opportunity. Yeah, I would like to ask a question about the aluminum sulfate. I've seen here in South Sudan, most of the people use aluminum sulfate in the market because it is everywhere in the market. And we don't know exactly the quantity that is used for treating maybe like a 20 jerrycan liters. So people just use it anyhow. I don't know, is there a specific quantity that can be used? And is the sulfur aluminum sulfur, can it treat also, can it kill germs? Can you use it for disinfection? Thank you.
Okay, thank you so much for your question. Just allow me, you're talking about alum. I just hope so. So usually if you find any product in the market, it usually has also instructions on how to use. So I'm not sure the type that you come across in South Sudan. So most of the products, even in the market, usually has instructions. Let me give, for example, like what I talked about in terms of, like, for example, if it's maybe aqua, like maybe liquid chlorine, it has instructions on the amount that you need to use in treating a certain amount of water. So usually it tells you like maybe you need to use maybe 2 bottle tops, maybe to treat maybe 20 liters of water. Same also like, for example, on purifiers. So even for the purifiers, for example, that 1 sachet is required to treat maybe 10 liters of water. So I believe even what you're finding in the market, for in South Sudan, you should be, what you're finding in the market, it should have instructions on how much that it should be able to treat water. Maybe you can also let us know later, maybe in the community group, how are they selling in terms of how have they packaged the alum, for us to know how much it should be able to treat. But usually when a product is in the market, it should be able to tell you instructions on how much you need to use for a certain amount of water. So even you find most of the products that are in the market, it gives instructions on how much you need to use for maybe the liters of water.
Thank you for that, Rose. Minal, I hope that is clear. You can see a few more hands up. Christopher, Dauda.
Okay, hello.
Hello, Christopher.
Yes, I can hear you.
Yes.
The question I want to ask is about the plant coagulants. Yes, I don't know if there is a quantity or measurement, and then how much of the moringa seeds can be used to treat, and for how many volumes or how many liters of water should be required. You know, for us here in Nigeria and where I am, Plateau State, moringa is common. So I think that can really help us in terms of treatment. Thank you.
Thank you so much for the question. Okay, so because they're more of traditional way, it's more, it's not a conventional way of treating water, but they have been found also to be one way of treating water. So maybe I may respond to you later because I may need to really clarify that. But I've not seen. Let me just go back there again. Okay. So they've been not documented studies really in terms of the match that you can use, but these are just highlighting that there are some communities that traditionally have been using some of the plant coagulants, but they've been not like real studies to show like the match. But if I come across any of the studies that have really found evidence in terms of using moringa seeds, I'll be able to share with you. So for today, I know it's I highlighted this because it's sometimes you find we're working in areas and you find that there have been traditional knowledge that people have been applying in terms of ensuring that water is safe. In one of the ways has been using the seeds. So maybe I'll look into some of the studies that have been done really to demonstrate maybe the match and the extent that it can really be able to provide coagulation. So I'll be able to share with you maybe later in the community group. Thanks so much for raising the question.
Thank you, Rose. And Christoph, I hope that was beneficial.
Yes, sir. Yes, sir. It's so beneficial, encouraging, sir. Thank you.
Okay, thank you, Christopher. I can see a few more hands up. Tanu Z. Brown. Tanu Z. Brown, are you there with us? You may unmute your microphone. Maybe as you wait for Tanu, I can see Omar Keise Ali. Omar, you may unmute your microphone. Omar Keise Ali. As we wait for Omar, I can see Kum Shamir Ta.
Yes, good morning.
Good afternoon.
Hello.
Yes, we can hear you.
Good afternoon.
Well, good afternoon.
Actually, morning in Cameroon.
Yes.
Yeah. Can I go ahead, please?
Yes, please do.
Okay. Greetings again from Cameroon. I had two questions that had to go along with, I wish to begin back with the usage of cactus plants for the treatment of water. My concern here was what part of that plant here is really of use. Are they the leaves, perhaps, or the back of the tree, or the seeds? It happens to be one of the plants that are so common in Cameroon, and it will also be very beneficial if we could use this method, because it happens to be loosely. Many people can. One question had to do with the treatment of water. It's basically very important because it applies very well to the community in which I live. I wanted to find out for how long can water treated with chlorine or aluminum chloride, for how long can it go? Because some of us, we might use this substance and maybe after a length of time it expires and we are out of knowledge of if it is still applicable or not. Those were my two questions. Thank you, and over.
Thank you so much for your question. I think most of people are really interested in terms of plant coagulants. Just allow me to be able to share with, because I promised your other colleague that I'll be able to really be able to detail, because of time now, I'll be able to detail the use of plant coagulants. So I'll be able to share with you in the course of the week really much about plant coagulants, how it really works, and which parts of the seeds, part of the trees that you really need to focus on. So I've taken it up, that question, and I'll be able to provide with a detailed answer for you and your colleague also who was interested in terms of plant coagulants. So in terms of chlorine, so I talked about, so usually chlorine has residual effects. So after you've treated water, you remember what I talked about, that it's important people to consume water immediately, when after treatment of water, people consume it immediately. And I talked about households should be able to treat water daily. So it means the way we usually encourage households is that if you've treated water, ensure that you use that water for that day. That one, you're sure that that water is safe. Even for us who are maybe living in an urban setup, by the way, so the systems really are you use maybe piped water, but usually we are sure like so in a conventional system, for example, let me just say, they usually do what we call a monitoring in different steps, in different points, to ensure that sometimes you may find that the chlorine levels are really gone down, even in the distribution systems. So they're usually able to pick up. But when in terms of a household level, we usually encourage communities or households to ensure that they consume the water that they've treated for the day, so that you are sure that that water is safe. And then the next day also, they do also treat the new set, and next amount of water for the day. So we encourage households to consume water within a day so that that's usually provide like assurance that the water is still safe. Thank you so much.
And due to time, ladies and gentlemen, allow us to come to the end of the session today. For any and all questions you have for our session today, you may write them on the community forum. I think we have posted the link, and we will be posting the link again for the community forum. And at this point, I'd like to invite back Anthony to give us a closing remark.
Thank you so much, Eric, and also to all of our participants today for being with us through the session. And as we come to the end of the session, this is not really the end, because we're going to be interacting with you further after the session. And that's why we say that ensure that you can be part of the community forum. And this is where you can post your questions. And based on the links that we have been sharing on the chat section, you can also go to our website. It's very easy. Make sure that you can spot the HG community. Once you click on that link, you're going to be prompted to create an account. So just your name, your email address, and then a password and a username, and that would be enough to see you join the community. So this is where you can interact with other professionals. All our facilitators, they are part of this forum. We also have other participants being part of this forum. You can come here, select a category that you're interested in. You can see like I can choose WASH, that is my area of interest. And you can even see some of the topics that we've had discussions about. You can start by introducing yourself, try to reply to this particular topic where you can mention your name, your country, and what you do. And then you can proceed and see some of the latest topics that we've been talking about. So based on today's webinar, you can see we were focusing on the household water treatment and safe water storage. So you may locate this topic, and then you can post your question by sending a reply to this particular question. So once you sign up, you're going to have a reply button instead of sign up here, and then you can post your question. So we promise to go through all of your questions, and then we can give you a response on the same. Also, based on some of the inquiries that you have posted on the chat section, most of us, they're asking, how can I train with you? How can I enroll with your courses? So that's why I would like also to refer you to the same website again. So the website is going to give you, on the homepage even, you don't have to go far, because you have all the courses here. So you might be interested like in the diploma course that I showed you. So you can click on for you to filter, and then you can locate diploma in water sanitation and hygiene. So here you can see further details. You can see the course background information. You can see the course outline, what will be covered. And this is what I was taking you through. You can see the course objectives, the requirements, some of the career opportunities you might be looking at, and then the tuition fee you can see there. So at the moment, as we said, we have a 10% discount, and that would mean enroll today, inquire about this course, register for the class of September, and you're going to save $100. That is a 10% of the tuition fee. So once you settle on the course that you'd like to study with us, there's a link to register. You can even see there's apply now button. So you can click on that link. There's a simple form that would pop up here where you just need to fill just some few details: your name, your first name, last name, your email address, your phone number, your country. You can choose the course that you want to do. You can select the level, and then you can choose the day that you want to start. You can try to hurry up so that you cannot miss out on the 5th of September class. which has a 10% discount now. So you can choose maybe 5th as your start date, and then you can say where you learned about it, maybe others, because this is from webinar. You can leave some comments, and then you just have to take on the terms and conditions before you can submit. So that's how easy it is for you to sign up for these courses. And we have also given all of our contact details, starting with the email address, the WhatsApp number, and the same you can find them on the website. So all the contact information details, you can find them here. Feel free to drop us a message on WhatsApp. You can write us an email. We are happy to even have another session with you to guide you further on the inquiries that you have. So with that said, I would like to wish you the very best. And we're going to share all the materials for today's session within the course of tomorrow. And how you get the materials, we're going to use the same email that you applied for, you registered for this event. In the meantime, some of us might have attended the session for the first time. So once you come to the website, we have a link for YouTube channel at the top. So once you click on that link, you're going to be redirected to our YouTube channel. And this is where you can see all the information in regard to the past webinar sessions that we have had. So you can even click on the videos, and then you can see we have very many sessions. So share the link with your colleagues. These are free sessions. There are quite many of them, especially on what you have done. This was the 6th episode, the 6th one. So that means you have like 5 more classes that you can be having a look at. So we encourage you to be part of the YouTube channel, subscribe, make sure that you can turn on your notification so that whenever we post a new video, you can be the first person to get that communication. So thank you so much. And as we close, I would like now to leave you with some of the videos for the courses that we offer, especially on water sanitation and hygiene, so that you may see what we cover when it comes to water sanitation and hygiene. So thank you so much, and all the best. And we look forward to having you join us for the September class. Remember, you can sign up today and save 10% by getting to enjoy 10% discount on the same. So thank you so much. And from us, bye-bye for now. You may be watching some videos here to see what we cover in this course.
In accordance with UN, it has been established that water scarcity affects more than 40% of the global population and is projected to rise. In addition, over 2.4 billion people lack access to basic sanitation services, such as toilets or latrines, and many communities are increasingly being exposed to a myriad of public health hazards and risks. Thus, WASH forms a key part of many humanitarian response programs. HumanitarianGlobal.com has worked closely with experts in this field to develop a detailed online postgraduate diploma that offers extensive knowledge and information resources about this practice area. In the provided 8 modules, the learner will get to learn about water supply in emergencies. In this first module, the participant will get to learn more about intervention context, sphere standards, and consideration for linking relief, rehabilitation, and development. Secondly, pumping equipment. This module will cover the various pumping equipment used in WASH, such as hand pumps, centrifugal pumps, hydraulic ramp pump, and the forms of energy sources that can be used in powering these pumps. Thirdly, sanitation hardware systems and concepts. The third module will cover basic concepts of sanitation, sanitation options, dislodging of pits and septic tanks, and reuse-oriented sanitation technologies. In addition, you learn more about sanitation software systems and concepts. In this module, the learner will get to understand more about the sanitation ladder, sanitation-related behavior change, sanitation marketing, and sanitation approaches such as CHAST, PHAST, and CLTS. The other module is sanitation in different contexts. In the 5th module, you will get to learn about sanitation in different contexts such as schools and emergencies, sustainable sanitation, and the linkage between sanitation, nutrition, agriculture, and food security. In the next module, you learn more about hygiene and disease transmission. This module will cover hygiene promotion, disease transmission routes, and the F diagram and hygiene perspectives at both household and community levels. Also, you learn about hygiene behavior change. Under this module, some of the topics covered include principles and components of behavior change programs, risks, attitudes, norms, abilities, and self-regulation, health belief model, communication for behavioral impact. And lastly, hygiene promotion management, epidemics management and global annual events. In the last module, the learner will get to develop more understanding about hand washing management, menstrual hygiene management, cholera epidemic and other epidemics management and global annual events. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.